Okay, let me introduce Sister Tai before we go on. Sister Tai is actually a registered nurse who have been working in Penang GH for many years until she got her optional retirement. Then she still continue because she continued to work because of the love for the nursing. And she was also trained in Australia for her enterostoma therapy nursing. That was in 1991, is it, Sister Tai? 92. So, okay. Then the training, she was one of those earliest nurses who got trained overseas, then come back when we have got about 8 of us in Malaysia. Then we started the Malaysian training for ET nurses. ET nurses is enterostoma therapy. That is actually a specialized nursing care that look after patients with stoma, wound, as well as continence care. And Sister Tai have also contributed a lot of her time training, not just locally. She trained, I think, many batches of those big training like ET nursing. She also did for smaller scale workshop for her hospital as well as other hospitals. She also did the training for last 2 batches of ET nurses in Sarawak. I think that was in maybe before MCO. Yeah, 2 batches.
Correct.
Yeah, and she have also contributed a lot of time in helping those developing countries to train volunteers as well as nurses in enterostoma therapy. Maybe I can let her explain a bit further because I can't remember the countries that she went. Okay, without further ado, I would like to invite Sister Tai to actually present us about the pre and post-operative care more related to colorectal patients. Yeah, this is important because sometimes the patient have most of our patients have already got their operation done. At times they may need a smaller procedure. They may also need to have got a repeat operation. So this is something that is important for the patient and the caregiver to understand how to prepare, how to care for their loved ones. Okay, thank you. Yeah, please welcome Sister Tai.
Thank you, Wong, for your kind introduction. I'm actually, can you hear me? Can you all hear me?
Yes,
Wong?
yes.
And actually, I'm involved stoma care for almost 30 years already. Well, time really flies when I counted. And actually, for 20 years, I meet the friends of stoma care, Italy, where we go to third world countries. That is from Indonesia, Sri Lanka, Mongolia, Vietnam. The last one is in Zimbabwe and Zambia. That is before MCO. So let me don't waste time. Can I start my presentation now? I will start with what is a stoma, by the way? It derives from the Greek word means mouth, and the ostomy surgery is created where which part of the intestine is involved. That will be either ascending or transverse or sigmoid. When it's a small intestine, it's an ileostomy. And the patient is called as ostomic. We call them as ostomic because derived from the word ostomy. So for the pre-op thing, keep on going up. For the pre-op, it covers physical and psychological care. Psychological care is the most important part, where the doctors will be the one when the patient goes into the clinic or ward. The doctor is the first one to tell the patient, and sometimes the family refuses the patient to know that they are having cancer. But end to it, last of it, the patient will come to know why are they having that long type of treatment. Whether the relative wants to tell them, they will come to know that they are having cancer. And the explanation, first one is from the doctors rather than from the nurses. And patient will also react when the patient knows that they are having to go in for that. Counseling plays a very important part for those especially having to work helping those in the clinic. It helps them, especially those support group people are serving, helping the to run the clinic. They need to know what is the aspect that they can deal of. But those of you who already undergone, this talk will be just adding more salt to your plate rather than help getting to know. Maybe I hope that this topic won't be just not interesting to you, but I hope that it will enlighten you a bit. But those in the clinic helping with the peer support group is very beneficial with this talk. And before you can talk to the patient, the doctor has already informed the relative or the patient their diagnosis, cancer, and what type of operation, which part will they do. A small intestine, which part is all by the doctor, but we as nurses or the relative also need to aware of it, understand what surgery are they undergoing and how the patient feels. That is the patient, the psychological aspect. The patient goes into stages of loss, denial, not accepting the fact that they have this cancer. Why are they suffering it? Have they done something wrong? Is it because they are being punished by God? They start to not accepting that they have this cancer, and they go bargaining. What have I done? Have I done something wrong? And they go into depression. These are the stages that those parents must understand, that those helping in the clinic must understand they face the stage of loss. Because especially to have very the back, how do they feel? Will they be isolated? Will nobody come to see them? Will they smell? Can they go back to work if they are breadwinners, especially? Can they support? If they are breadwinners, can they continue their work to support the lifestyle? Acceptance will be the last part in their life. And I think we have previously, psychologists have talked to us in one of the health talks on all these stages of loss. So I won't cover too much of it, spend time on it. The physical part, the routine investigation that everyone has to go in, PET scan or CT scan, and all the blood investigation before they come to the diagnosis, even a colonoscope to be done. Then in the ward itself, usually the patient will be admitted one day beforehand, and antibiotic will be administered, usual prophylactic antibiotic. Physio is good, pre-operative, if a physiotherapist come in. It's very important for the chest expansion after surgery. Bowel prep plays a very important part, but if I don't think most of you, those who have undergone the bowel prep, will say, "Ayo, even a colonoscope is very dreadful of drinking all those water and running to go to toilet." It's a very torturing part. And on admission itself, then they will put on nourishing fluid. The nourishing fluid the patient can take is without milk. You can have tea, plain tea, but no milk. That is very important. The day before surgery, and then clear fluid up. And in the morning when you have to drink the colonic wash out in the morning, you still run to the toilet, but you need to take a lot of clear fluid, that is water, to let all out. If not, if it's not clear, the surgery will be a problem, and if dirty, contaminated the surgery part as well. So bowel prep plays a very important part in the surgery and for colonoscopy as well. Stoma sighting will be done by the nurse to get a good ideal position for the stoma creation. Any question before I go in? I'm very brief in it because most of you have undergone the surgery. Only the nurses need to know. Any question before I step into post-operative?
Hi, Sister Tai. I'm Sarah here. I have a question.
Sure.
I'll be doing sigmoidoscopy. Am I
Yes.
pronouncing correct?
Correct.
Okay, I'm doing procedure on
Yes.
the 29th. So I've given the fleet enema. Okay,
Yes.
I just want to double confirm on how to use the fleet enema because I've never used it before. So we will press it in
Yes.
the stoma,
Your anal region.
anal region, because I have a stoma.
Stoma. So you can press it through your stoma itself.
Oh, okay.
The functioning part, you have only one side, isn't it? What's that, colostomy?
Ileostomy. I have two. Yes.
The stool that is coming up, the part that your functioning part, that the stool comes out, the feces that comes out.
Oh, so is it the one that connecting to the anus or the one that I have my output?
Your output.
My output, okay.
So that the whole intestine, when they examine that intestine, is all clear. It plays a very important part.
Okay, so we just pressed it through the
Press
hole.
it in, yes.
Because I'm worried. I have never done it.
No problem, no problem. Because they want the whole area to visualize, make sure when they put in the scope, they want to ensure everything is clear.
All right.
Okay. If there's a blockage, then cannot be seen clearly. Very important for them to visualize, to see.
Okay. All right. Thank you, Sister Tai.
Welcome. Any more questions you would like to ask me before I go into the post-op care? Post-op care is more prevalent to most of you carers as well as the patient. So there's no question. Let me run through. When after surgery itself, the patient condition is monitored, the pulse, the blood pressure, oxygen level, all are stable. That plays a very important part. Then the next one, diet. All of us, all the patients hungry already, right? One whole day starving, not eating anything. They will be very anxious. When can I start to drink? The thing is, the first part is the stoma must be functioning. The bag is bloated. Now we don't pass through the anus anymore. The stoma there, the hole there with your bag attached is bloated. That means you pass flatus. Because any surgery, everyone who have undergone any surgery, the doctor will ask, have you passed flatus? But the flatus is passed through the bag. I just want to highlight to you, just share. Usually the house officer say, oh, not functioning yet, not functioning yet. But when they open the blanket, the surgeon come on rounds, or the surgeon come around, they open the blanket and the thing, they see the bag bloated. That means it's functioning. The patient already passed flatus. And once they pass flatus, they will start to give sips of water first, followed by clear water. And then if tolerated, no vomiting, they can set up to nourishing fluid. One second day or third day, that depends. Usually within 48 hours, the stoma will start functioning. If not functioning, everybody will be worrying, especially the doctors. They will worry, why not functioning? What happened to the surgery? Or is there something blockage or anything that happens to it? So once they start nourishing fluid, the next step is a soft diet. Normal diet will be a later part in your rehabilitation. Soft diet first. The diet part, I will deal with it later more. And the other aspect is we are to observe the stoma condition. It's pink like your mouth. Your lip of your mouth will be the resemble how the condition of your stoma. It shouldn't be blackish. That means if it's black, it's worrying to the nurses and to the doctors as well. That is ischemia, is an early complication as well. And we also observe whether the stitches are intact and the skin around the area is healthy as well. And usually after surgery, you see the stoma is oedemated, swollen. It's a normal process because this is a mucosa. And when they do the surgery, they invert it, and that will cause inflammation. So oedematous are there. It takes around 3 to 5 days, sometimes a week before it subsides. So don't get worried about it. This is a normal process. And first thing, after surgery, very important, immediately they apply a bag that is not filter. You cannot apply a filter bag because you want to see the platelets coming out. Immediate after surgery, if you apply a platelet bag, then you don't know when the stoma functioning. And very important, you have to protect the wound around the main wound. A laparotomy is done. So don't get the feces contaminate the wound. It's very important. And 1/3 full you can drain. Usually they apply a 1-piece drainable bag immediately. And make sure it's correct size. And you are not allowed to patch any leakage. You know, when a bag that is applied, when there's leakage, you don't just apply, just patch it, tampal it. You must change whole thing. Pouch changing is good if you change it before eating. It doesn't, before the thing is active. After food, are you feeling that after food, do you realize those wearing a bag? How long does it take for the thing to come out? Can anyone answer it? Experience it? After food?
To me, immediately.
Immediately.
Because
yeah.
I'm me.
Yeah, your ileostomy, immediate. Because depend on which area. If it's a colostomy, it takes longer time. So immediately. So it's better to change before eating. And ideally, 1-piece drainer bag, you change it within 2 days. A 2-piece system is 5 to 7 days. So all of you have experienced all this bags that is available in the market. I think that anyone have problem with bags, we should have a session on the bags itself. You can ask us today, anyone have problem with bags that you are using now, or carers have any problem with dealing with bags? You can ask us later. And we are shown all the various bags. I hope everyone knows all different bags available in Malaysia. Market, they have in Malaysia, we have L-Care. And I think L-Care, a lot of people doesn't know, is from Japan. We have Convatec, Coloplast, and Hollister. Vibron now doesn't have any more stoma bag in the market. And how many of you are using, anyone have problem of finding market bags available in the market? I think no problem lah. Everyone have those bags that is available by the sales rep or introduced by the nurses. And where to get the appliance, how to store is important. When you buy the bag, please don't put it in your car booth and forget to take it out, hot sun. That will cause the adhesive, loss of adhesiveness. Storage, cold temperature, and don't buy too much. Don't worry. I cannot get my stock. I must buy for 6 months, 4 months. Please don't do it. The wear and tear, the adhesiveness. So sometimes the patient will complain to me that, oh, last batch I use longer, can stand me for 5-7 days. This one 3 days gone. So when I find out, they store it at the car booth, they forget to take it because they travel from island to mainland, they forget to take it out. So please make sure storage plays a very important part for your appliance. So are you comfortable? Are you happy with your appliance? I hope all of you are happy with it. Appliance plays a very important part in your lifestyle. Hygiene care, also important. Make sure you monitor that there's no redness around it. Be gentle. Don't rub the whole area of your skin until, you need to clean it because fleas is coming out there. You are worried. Or your carers who are managing it. Please do it gently. Use soap and water. You doesn't need, some say, oh, must use Dettol to clean it. No need. Just soap and water. Basic. Enough. Clean it. And if there is skin rashes, don't wait to become worse. Seek the help of the nurse there. You go to your hospital and the stomach care nurse in your clinic, colorectal clinic, can help you. And you are also taught on the application, and I won't deal with it, how to apply. I think everyone has done it and the family members knows how to do it. Unless someone has problem of it, then you can post this up question later to Wong or myself. Diet, as I told you, is important. Everyone wants to eat. When can I start the diet itself? A balanced diet plays a very important part, especially those who are already after surgery itself, wants to go in for example, before going in for chemo, they must really nourish themselves, put up weight a bit, because during the time when you suffer with cancer, before surgery, you are initiated, lose weight, one of the signs and symptoms of colorectal cancer or all the cancer. So very important, nourish yourself, build it up before going for chemo. And for drink plenty of fluid, and especially ileostomy. Sarah, you drink a lot of fluids for replacement for your loss?
Yes,
Right,
yes.
Sarah?
Yes.
Yeah, very important. And you have to chew all your food thoroughly to prevent food blockage, especially ileostomy. Why? Because the ileum intestine diameter is small compared to colostomy. Colostomy, seldom people suffer food blockage. Sarah, do you know any food that can cause food blockage?
I think like nuts,
Yes.
corns,
Yes.
the fibrous food,
Yes.
vegetables especially.
Vegetables, yes. Any other? Mushroom, don't forget.
Mushroom, yes.
Yes, because you cannot chew because it's slippery, you know. We have to chew.
Yes.
And I hope anyone in our group here suffer food blockage.
I remember eating mushroom and it came out just as it is.
And not only you have colostomy or ileostomy, you know. Myself, with a denture, I hardly chew that well. My output, pickle, you can see. Even some vegetable corn, especially meat, it come out as well.
Yes,
Not
yes.
only those in the ileostomy or colostomy, you know. We also suffer that, especially those with wearing denture, unable to chew well. And it's good for us, for new patients, to try one new food at a time, and then record how is your output like. If the output is good, then there won't be any problem with that food. So it's good to record. So if the output becomes diarrhea, then you must think, what food have I taken? Even when I have diarrhea, I say, hey, what happened last night? What do I take? So for y'all, also very important, isn't it? And to eat regularly, don't get air goes in, and then eat, enjoy your food. Don't say, oh, I must take care. I don't want to put on weight. Please, you all are suffering with your cancer on treatment. So your appetite might not be there. Very important to keep up to eat. And don't forget, you use straw to suck all your drink. All the air goes in, will come out in your bag and bloated. So you will suffer a lot of bloating in your bag. One of the reasons, talking while eating also. Your bag also can bloat. Chewing gum, smoking, because you swallow all the air. So carers of patients suffering this, think of, be quiet, like the habit that our parents always tell you. Eat first before you talk. So effects of stomach output is also from gas forming food. The odor, would you want odor or would you want to have loose stool? So the diet plays a very important part. I will show you what are the diet that can cause gas in my next slide. And how to thicken your stool, especially the ileostomy. So the food that can cause gas, fluctuation means gas, cabbage, onion, beans. Odor, onion, petai, especially petai, the petai, when you pass urine, those ileal conduit will smell, isn't it? Even we ourselves take petai, our urine come out, got smell as well. Garlic will also cause smell. Diarrhea will be those spicy food, chili, curry, beer, and all that. Anyone would like to share? Do you experience all this? Anyone would like to share? Why so quiet? No one. Then, when you have ileostomy, early part of ileostomy, where the doctor asks you to start on diet, you have start on nourishing food, soft diet already. Please less water on your soft diet when you cook your rice. Make it soft only. And the rice can help to make the stool more solid. Eating banana, potatoes really help. I have experience because my uncle is a patient of ileostomy. So I make for him smashed potatoes and the ileostomy to become thickened. You have also smooth peanut butter, stew apple, because apple, when you stew the apple absorbs the water. Banana also helps. to make your stool more thickening or prevent it to be too loose, especially ileostomy. So can you pass motion after wearing a colostomy bag? Do we all experience it? Especially those permanent ones. Any in our group here suffer? I still remember in our chat group, they did mention, why am I having still passing through anus wearing a colostomy bag? Yeah?
My
Anyway,
experience, the first few months, I had once or twice.
yes,
That's all. And then that's all.
Yeah.
Now,
yeah. Immediately after surgery, your anus may expel poop, even platters that you can pass out, because those left behind the lower part of your operation, your intestine part or the colon part, rectum part, the left behind the fluid, and that is the one that is happening, that you still rush. And do you feel that you have the urge that you're going to pass motion still? Like we lose a limb, you know, those, they have amputation of the limb, they feel that they still have the limb. This also has happened. Phantom limb syndrome is called, this one. That you still feel that you're going to pass motion, but actually not so. And when you go often to the toilet, you will see mucus, because intestine feel that is peristalsis, and peristalsis will rub away against the intestine mucosa, and that causes the mucus that's coming up to your anus. That is at the early stage, not the later stage, please. This is early stage only. It happens.
Sister Tai, what if
Yes.
I still have the mucus coming out once in a while? Not regularly, once in a while.
Because your intestine, there is still peristalsis.
So it is okay lah, even after
It's
one.
okay. Because the peristalsis will rub each other, the movement of your intestine, and the intestine rub each other, the mucosa, that causes the mucus.
All right, thank you.
That is the reason for it, that you have mucus expulsion. Okay, it comes out through your ileostomy or through the
anus.
Anus, yes.
Okay,
There's
thank
still peristalsis is still there. So the peristalsis is the movement of your intestine. When you chew, you see peristalsis movement. That wrapping the mucosa of your intestine, and that wrapping can cause mucus coming out. Okay? But not excess lah, I think so.
No. It's just once in a while.
Once a while. Yeah. So you can do activities after the surgery. Bathing, you can bathe with your pouch on or remove. Can all of you, those carers or patients, do you bathe with your bag on or remove? Anyone like to share? Anyone like to share? Do you bathe with your bag on or remove?
If anyone wants to share your experience, please,
Yes.
okay, feel free
Yes.
to do so.
Yes? Bag on, is it?
I take my bath. I take my bath with my bag on.
Yeah,
But
good.
the shower cap, I mean, this stomach cover.
You cover your bag to prolong usage of your bag.
Yeah.
Long. Yeah. How long can you last your bag? 2 weeks.
7 to 8 days.
Wow, that long, because you have a cover on it.
Yeah.
But you change your adhesive, is it?
Mine's yeah.
You anchor adhesive around your base plate. Anyone else? And you can wear anything as long as you do, no worry lah. Let me show you later. Our Candice, you think she is our patient with colostomy, but she wear, you don't think she is a patient. And even you can pray. Sarah, have you problem of praying, wearing a bag?
No
Sarah?
problem. No problem.
Huh? So how do you share? How do you want to share?
Because I'm using one piece. So when
no
I'm on ileostomy, I flush my bag, I think at least 5-6 times a day, at least. So 10
Yeah.
times is normal for me.
Yeah.
I'm not comfortable having anything like it's bulging.
Yeah.
So before prayers, every time before prayers, we have 5 times prayers. Every time before prayers, I flush and then clean it and then take ablution and salat as usual. No problem.
No problem. And as long as the feces doesn't touch your body, it's still considered to be clean.
Yes, correct.
Correct?
Yes, correct.
Yeah. So very important. Halfway during your prayers, if you come out, don't get
It's okay.
panic.
No.
It's still
This-
okay.
okay.
It's still okay as long the feces doesn't touch your body. You are
Yes.
still covered, considered to be clean.
Yes, correct.
Yes. And you can, but the heavy lifting, 3 months to 6 months, avoid it. And you can do your jogging and go for activities, your daily life, and even have sex life. Don't think that with stoma you cannot perform. There's no hindrance in it, please. Family support plays a very important part in our adaptation. The patient relative can help to change, but it's good later part if the patient itself, the osteomate, can help themselves, but maybe they just drain. On changing part, the base plate, the partner can help. Isn't it? Most of them. Do you all experience it? Or you do it yourself? One piece, no problem. For 2-piece system people.
Usually I do it myself.
Yeah.
Right from the beginning lah.
Yeah, beginning part. And you need a family support. Encouragement plays a very important part for every patient. And you can go out. Don't worry. You see, Sarah has gone to Kelantan some more. Come back safe. And our Candice, if Candice is around, Candice.
Yes, I am.
Yes, Candice, you have gone to New Zealand? Not yet.
I've gone to the States,
States?
New Zealand, and Australia.
You see? She has
Yeah.
traveled. So doesn't
Traveled
mean
for
that with the bag,
6 months.
yes, with bag you can still travel.
Well, during the flight, how do you clean your bag, huh?
Yeah, Candice can share.
I'm wearing a two-piece.
Yeah.
I don't need like, if it is like 30 hours flight, I can still last. I mean, the bag can still last for a while.
Mm.
Yeah, I just wipe it and then throw it.
So Candice can share. You see, our Candice is here. How she look? Very elegant. Everyone agree with me?
Yes.
Yes.
Yes. She's so, during our World Ostomy Day awareness, she's in the forum, and this is my 2 Siamese twins that is already from young. They wear bag, and now they are age Form 4 and still wearing a bag. See? Form 4, you know, 2 Siamese twins. And this is an ileoconduit patient. So when you wear a bag, is how you see yourself, your mirror. Don't feel scared. Candice, how do you feel wearing a bag? Candice?
Yeah, I'm very comfortable now after like 14, 15 months.
Yes,
Yeah. So, but initially
yeah.
I don't know how to handle, but now I'm able to do everything by myself. Even
Yes.
standing up, initially I thought changing is like you have to lie down on the bed and then get
Yeah.
everything set up like in the hospital setting. But now sometimes I could do it just by standing up in the bathroom,
Yeah.
get it changed.
Yes. So you have to change your thought. You have to change your thought and change your world. That you are not alone. You are not, everybody doesn't know who you are and ultimate. Nobody, can everybody knows, even some of them see your photo and say, huh? She is a patient now. I think yes. So everyone, please change your thought that nobody will know. Whether you're going to tell or not to tell, how secret you are is up to individual. You see, this man wearing it doesn't need to expose. It's up to you whether you want to tell that you have a bag, you are wearing a bag to your close friend. Nobody would know that you're wearing a bag. It's up to you. So don't be shy that you're wearing a bag. I cannot go out already. Everybody was thinking that I smell. No, you take care, hygiene well, and you drain it well. When it's full, you won't smell. The bag now is odor proof. Do everyone tell your close relative any experience? I only target one Sarah, Candice,
Uh,
Lynn. Do you experience?
yes, like to tell them is more for also educating them because many of them still don't know that ostomates is is it's not like those olden days, you carry a big bag around, not
Yes.
even around you have to hold the big bag wherever you go and you have to wear sarong all the time.
Yes.
It's no longer that. So they show
Yes.
interest. They want to know, "Oh, how is it like?" So I give them the some sort of education. I even show them a copy of a step of the uh, pouch and the wafer to show them how it works.
Yes.
And they are happy to learn that.
Yes. So it's up to you whether you want to tell them or not to tell is individual. So whether you want to keep it a secret, it can. Some of them scared, say, oh, the relative will know I have a bag. They don't want to come and near me. So it's up to you. You are not alone, please. We are lucky. We have apps, you have the telephone, messengers. So you are not alone. You can access now how to use it, where to get the bag, and support group. Our quorum support group is there. And here, I'm so happy that all of you are with the quorum group and you were tagged. And I pray that all of you will also join in during the Zoom link Tuesday and Thursday, rather than just text. You can share your experience. So any more questions for post-op care? If not, any more? Anyone like to share something? And I just want to add in a bit of reversal. Any question? Quiet means no answer. Huh?
Focusing.
Focusing. Okay, then I do on a bit, attach a few slides on reversal. So for reversal, all of you, those with, especially not the permanent one, a temporary one, looking forward for reversal. But
Yes.
if if you are all right, there's no problem with your health and no metastasis, and you can handle another surgery, everyone will be happy to go in for a reversal. And before a reversal, you need, like what Puan Sarah went in, scan now a sigmoidoscopy. Through the sigmoid, Sarah, you are going in through a sigmoid. They are going to look at the sigmoid area. Is it healthy or not before they close it? So any of our friends here have undergone closure? Anyone in the group have undergone closure? No answer. Earlier part, I was mentioning bowel prep. For closure with this, usually they don't need as before because we are passing incontinently. The feces keep coming out very clean already. So not necessary to undergo bowel prep, but you need to start clear fluids without milk after your admission to make sure you don't eat any solid food, no low residue, clear fluids only without milk to make sure the area that comes out is clear. And after the surgery reverse, this is the part that everyone says. The bowel needs training and it takes time, sometimes 6 months or weeks or months, depending on age, your fitness, and what is balanced in your intestine before the feces that is coming out to be normal. So you need to train your bowel because it's not functioning. Maybe you haven't have, you are wearing a bag to 9 months. Puan Sarah, how many months already? 9 months, 1 year?
A little more than a year.
So long time. The bowel hasn't functioned for normal stage that you are facing. Formerly, you're passing through your anal, now through the ileostomy that is uncontrolled. Your ileostomy, there's no control, keep coming out. So it needs to get trained. So be prepared that when you pass the first plate feces, before you pass, please apply barrier clean around your anal region as a protection because the feces that's coming out is usually watery. And it can be 3, 4, 5 times like you're having a diarrhea. To get it back to normal, it takes time. So it's good that you can apply Vaseline, zinc cream. You can put zinc cream plus stomach acid powder, mix it like Colgate, then spread it to your anal region to prevent sore. prevention is better than cure. So this usually happens after the reversal. And when you clean your inner region, dab, don't rub, dabbing to prevent sore around the skin area. And the priority is hygiene, because you pass a lot of watery stool until it becomes normal. And then the food intake plays a very important part, as what I mentioned earlier. Here, you are to prevent taking high fiber, low fiber diet when you have your reversal. White bread instead of the wheat bread, and your fruit all must peel the skin. Smaller portions of fruit and vegetables to get your fecal amount coming out, you're training your bowel. And those spicy food you avoid also. And it's good that you put up a diary, as what previously I told you. The output depends on your intake. And you are to eat little regularly until you return to a healthy, balanced diet. When you have diarrhea, biscuit, toast bread, it plays a very important part. And some have loose stool for months and months because the bowel is very active. Doctor can prescribe medication. So you can go back to when you recovered your bowel management, but still you are not allowed to do trainer's exercise for 3 months during the healing process. And it's good if you have pelvic floor exercise. This will help to prevent incontinence, pelvic floor exercise. So, all of you live a wonderful world. You are given a second chance to survive. Think of the wonderful flowers that's blooming. Daily you wake up. And this year, World Ostomy Day theme is life is awesome with ostomy is a lifesaver. It's a blessing. Do you think so?
Yes, it is.
Anyone want to comment? It's a savior, isn't it?
Yes,
If you
it
don't do an ostomy, can you survive now? Till now?
I doubt.
You doubt, right? You definitely cannot. You might have problem. Now at least you can think of seeing those who are young, when you see the grandchildren some more. So it's a blessing that we receive. Ostomy surgery is definitely, it saves your life. I think all of you agree with me. Is it? Any comments on it?
Yes, life after ostomy is a blessing.
Yes,
New life.
yes. If not,
Learn a lot of things. And
lot of things.
live
Not
to-
only things, but you can see your life daily. You can see, you can go back to your normal work. You can do. So it's a life saving. If not, you go septicemia and die on the table itself. You come in if they don't operate on you. Correct?
Yes.
Mila? Yes. So take it. After your surgery, don't think ostomy surgery. You are already drained off. You are already down. But remember, you have the quorum support group. Everyone is there. Even you can use your internet, laptop. You are not alone now. Thank you. And those wearing bag, you stick on it still. I will always stick by you. Correct? For those wearing the bag,
That is our Ostomi's wish lah, always stick by you.
yeah, stick by you. Yeah, your wish.
Okay.
Any
So
question?
yeah,
Thank
there
you
any
for
more?
enlightening us.
Yeah. Welcome, Mila. Welcome all of you.
Thank you, Sister Tai.
Yeah, welcome.
Thank you so much to Sister Tai for very how I say more interactive session, and also it benefited those people who are preparing for their second surgery like reversal. And also she also had bring in some idea about problem to look out for after closure, after the reversal, things like that, which is something very useful, I think.
Yeah,
Thank you.
welcome. Anyone wants to voice out
Yeah,
any problem that you
we have got 1 more hour, is from 12 to 1. It is a session that we can do some sharing.
sharing? Yeah.
Yeah, maybe Sister Tai, you want to stop sharing your can
Yeah. Then I stop sharing already.
stop sharing. Okay, now maybe if there's any more sharing
Yeah.
that can come in, I think we can we can do some sharing. And I'm happy that today many nurses are in. So the nurses, I think
Wow, Pan also come in.
you can actually listen to some of the real life experience from ostomics themselves, which is actually something very enlightening. Sometimes for us ET nurses, we also learn a lot from the patient. How they manage. Each one have got their own way lah.
Yeah, correct.
Thank you.
Thank you. Yeah, thank you. Yes.